If I look, this is the temporal bone, right here. If I go here, here, and here, this is the zygomatic process of the temporal bone. This is the external auditory meatus, and this is the mastoid sinus. Here, here, and here. Zygomatic process of the temporal bone, the external auditory meatus, and back here behind the ear is the mastoid sinus or the mastoid process. What do we call the little pointy things in the ulna and the radius? Which one? The styloid process. This is the styloid process of the temporal bone. And right here, I have that depression. On some models, there's some rubber, there's some grommet there. Notice that the mandible fits right in to that depression. See it? Allows the mandible to do this. So this is the mandible. That makes this the mandibular fossa. On the test, it said, where is the only movable joint in the head and face? It's where the mandible touches the cranium, right there at the mandibular fossa. TMJ, right there.
TMJ.
This, what? This is the maxilla. Maxilla holds the upper teeth. You had a question on the test. It said the mandible has what? And then it says alveolar that holds the upper teeth, alveolar that holds the bottom teeth. A lot of you put down, and then it said A and B. A lot of you picked A and B. The mandible doesn't hold upper teeth. The maxilla does. Mandible holds the lower teeth. When I look here, this is the hard palate. Take your tongue, push it up against the hard palate. If I push it over here, there's a suture right there, right about where the screw is. The anterior 2/3 of the hard palate is the palatine process of the maxilla. This bone way back here is palatine bone all by itself. Then we do the openings. Looking this way, this is the foramen magnum. Foramen magnum is part of the occipital bone. Here's the foramen magnum. There's the jugular foramen. This one's not. Yeah, it is. It's cut, but I can't get my stick through. Right there is the carotid canal. And then we come to this little oval one here, and that's the foramen ovale. When I look from the inside, I can see 5 openings. 1, 2, 3, right there. That is the internal acoustic canal. Then I jump over the hill, and right there's the carotid canal, and right there's the foramen ovale. Once again, foramen magnum, jugular foramen, internal acoustic canal, jump over the hill, right there's the carotid canal. Can you see it again? And right here is the foramen ovale. That's the 5 in the back. Then look them in the eye. See that round hole